What about cosmetic interventions? Is this also something that a lot of people are turning to with low body image and perhaps other mental health conditions?
Yes, I love chatting about this. So I think what we have seen in the last, I suppose, 10 years or so is quite a big upswing in people accessing things like Botox and fillers. So they're what we call non-invasive cosmetic procedures as opposed to invasive procedures, which are things like breast augmentation, nose jobs, where there's actual cutting of the skin. So in terms of the invasive ones, we've seen, they go up a little bit in popularity, but the huge interest has been in those injectables, the Botox and the fillers, and just being able to get it at your local shopping centre. Just, I'm going to nip down to Coles for our Australian listeners as a supermarket and get some bread, but maybe I'll get some Botox as well. Just the accessibility is so high now that it's become rather mainstream.
And is the incidence of mental health conditions within this population, so people that are seeking non-invasive or invasive cosmetic interventions, is that incidence on par with general population, or is it higher?
And, I wish the research in this field is a bit patchy because some studies will say that there is absolutely no difference in mental health status of people who are seeking surgery versus those who are not. And really the only difference is that these people are concerned about a particular area of their body that they're getting operated on anyway. I suppose in my research, I've found sometimes that they have a bit of a lower quality of life, maybe a bit more anxiety, depression, maybe they have body dysmorphic disorder. So in my research, there has been a difference between the general population. But again, I suppose it depends on who you're using as your control group in these studies, and that's, a matter of debate as well.
I know you spent quite a bit of time thinking about screening for body dysmorphic disorder prior to cosmetic interventions. How satisfied are patients who have body dysmorphic disorder after a cosmetic procedure?
Yeah, this is, again, where the literature can be quite diverse. Back in the day, we used to think that body dysmorphic disorder was this massive contraindication, that if people with body dysmorphic disorder had cosmetic procedures, they felt worse, more likely to sue the person who performed the procedure, sometimes in terrible cases killed the treating practitioner or hurt themselves. So it was always just terrible outcomes. But I suppose in my research most recently, and I do wonder if these are people who might not even have body dysmorphia, maybe it is just negative body image, they actually felt better and they lost their diagnosis. So it's not clear cut. And again, probably speaks to a bit of a wishy-washy definition of body dysmorphia. Imagine if we had a genetic marker and could just tell exactly who they were, it'd be so much easier. I suppose body dysmorphic disorder is the one disorder that cosmetic surgeons tend to look out for. But in my research and my clinical practice, I'm encouraging people to look out for more than just that. There are other things that can lead to someone having a bad outcome.
You've stated, and I have a quote here, not enough is being done to ensure the psychological safety of people requesting cosmetic procedures. So in your view, what should be done that is different to what's happening today?
I honestly think we are taking steps forward, which is really, really good. In my mind, it should be mandated for any cosmetic procedure. People will say that's too much. It's too much level of governance. But I just honestly think that if we compare it to, say, like bariatric surgery, heart surgery, they all have psychologists as part of the team. It's just absolutely routine. So I just think it's bringing it into line with every other area of medicine, really, where there's going to be a significant life change.
Playing devil's advocate here, my understanding at least with a lot of the non-invasive procedures is that, as you said, they're so accessible now. You can find them in the local shopping center and often are not carried out by doctors or nurses. And so if you made it mandatory to do a psych evaluation with a psychologist before a non-invasive procedure, I think that would really hurt the bottom line of a lot of these businesses.
I'm just not sure about people who aren't doctors and nurses giving injectables. That really worries me so much. Like, would you go get your COVID vaccine from your hairdresser? Like, you just wouldn't, okay? These people have been trained to give these injections and aftercare. So that's a whole another area of regulation. And I suppose as part of their training, doctors and nurses are given at least some input on mental health. So it's not such a bridge too far for them. Like they should be asking these questions anyway. Potentially it doesn't have to be every single time they come for their fillers or Botox, because we know that, this can be done every 6 months, for example. But I would think a new patient should probably have this done.
And this might be another area where AI can kind of be of help.
I want to retire, so yes, I'm all for it.
What is the risk if appropriate screening isn't done and someone with body dysmorphic disorder is undergoing a cosmetic treatment?
Yeah, so, and I should say that these people are in the minority anyway, because I do these assessments. At least I used to do them quite routinely. The risk is, I suppose, that they are dissatisfied and they go back for more and more and more procedures. They doctor shop, they litigate against the treating practitioner because they didn't deliver what they wanted. They hurt themselves. Unfortunately, body dysmorphic disorder has a really high suicide rate. So there's sort of harm for themselves, the health service that provided it. There's a lot of things that could go wrong.
So are you against all cosmetic procedures? It sounds like you're not totally against them.
No, not at all. Because I tell you, the vast majority of the screenings that I do, it's like, yep, go ahead. Sounds like you've thought this through, and you understand the limitations it would have on improving your life. Those kinds of things. So no, I'm certainly not. And I have always been someone who's worked a lot with people in the cosmetic industry. And I praise everyone who's been open to working with me, because often psychologists are seen as skeptics. So no, and the vast majority of people have a really good outcome. They get their nose job done and that's it. They don't have any more procedures the rest of their lives. So no, definitely not against it. And I'm really glad to see there's a bit more tighter regulation going on in Australia, at least.